Kurt Wilhelm, your co-host of Ageless Living, and
this is Dr. Lee.
thank you for tuning in. And we also thank Dr. Lee for lending her great licensing for as a physician on the show. For those of you who are just tuning in, Dr. Lee has licenses to practice Eastern medicine from China, and also here in the United States practices not only at her own practice, but also in a couple of other hospitals in the area as well.
I actually practice anesthesiology and acupuncture. Excuse me. Partnered up with Dr. Robledo, we also have a med spa called Arizona Laser and Skin.
Okay.
And we're located in Chandler Boulevard and I-10. Cross street is 46th Street.
So if you go to Chandler Boulevard and 46th Street and go south just about a block on the left-hand side, there are some trees that are blocking the the Arizona Laser sign, but take a left in there, and they have wonderful and gentle and staff members that will just take wonderful care of you. Best customer service I think I've ever seen anywhere. And then when you get your free consultation, which we want to thank our sponsor Arizona Laser and Skin for providing free consultations to anybody who calls in. If you just are curious and you want to learn about the med spa business, make sure you call this phone number to make a consultation visit.
It is 480-598-9733. And by the way, the website is www.azmblaser.com.
Wonderful. Now, what we're going to be talking about on this segment is kind of exciting, and the reason it's exciting is I've actually had experience with it myself, and so I'm going to be talking a little bit about my own experience, but there are different ways that you can improve the look of your face, and we're going to be talking about those on the air. But Dr. Lee, do you want to talk about that, introduce that idea a little bit?
Absolutely. I also wanted to mention we are fortunate to have a guest, Dr. Robledo, who's an expert in this field too, and we'll have him join us. Welcome, Dr. Robledo.
Thank you very much. Thank you for inviting me.
You bet. In fact, Dr. Robledo is the one that performed this on me. So
that's right.
We're going to talk about that. But the focus is in general. I mean, I can definitely speak to it. I've had the experience of it. I just know that my wife is jealous. More to come. We'll talk about that. But Dr. Robledo, tell us a little bit about the different options that are available out there, and why CO2 fractional laser is a great option for people.
Sure. At our clinic, we evaluate patients, and if we determine that they need something to resurface or improve the texture of their facial skin, then we have a lot of options in our office. But I think one of the best options that we have and that exists currently is the CO2 fractional laser. Mm-hmm. You know, the CO2 laser has been around for many, many years. But initially, it used to be a straight, laser, very difficult to control, with high probabilities of suffering secondary problems such as scarring and deformities, etc. The current CO2 lasers are mostly fractional, which means they are more computer controlled and they're a lot more safe and predictable as far as the results go. The chances of suffering any kind of damage, deformity, scarring, etc. with these fractionals is very, very low. And within that, the CO2 fractional laser is an amazing tool and device. It can resurface your skin. It can improve the texture of the skin. It increases the collagen in the skin because it's a thermal stimulation to the skin. So a lot of the fine lines and wrinkles will start fading away or even disappear. It addresses also the sun damage, the hyperpigmentation, the brown spots, and it tightens the skin too. So it's an amazing device, and we use it in two modes. We can do low energy treatments, which have very little downtime, very little discomfort, and I think you can relate to that since that's what we did in your case.
Yeah, absolutely.
And of course we can use it in high energy form. And this is for patients that are just, not able to have the low energy repeated. They're going to go out of town. They just want to get it over with. We do high energy, and it does have a few days downtime. The results are just as good with high energy as they are with low energy. And so it all depends on, we try to tailor it to the needs of the patient. It all depends on what their concerns are and what their needs are. But it's an amazing device. It gives great results, and we love it. You know, I try to use it every time I can in combination with either facelifts, with any kind of cosmetic surgery, with other treatments of the face. You know, sometimes we're addressing other issues and concerns, but like I said, skin resurfacing, everybody can benefit from that.
Absolutely. A couple of things to point out. My wife actually pointed out, I think it was Snow White and the Huntsman is the movie that came out, and Charlize Theron, who is a very, very beautiful actress, was playing the kind of the wicked queen, and so they had her in her younger years, where you know Charlize Theron is a very beautiful actress. But when they aged her, my wife noticed the only thing they did to age her was to put age spots on her face, and she looked 40 years older. So the point is that sometimes just in that resurfacing, just getting rid of some of those age spots, it's one of those things. For example, I'm, again, probably sharing way too much about my family, but my father is walking around right now without a front tooth. Not exactly quite sure of the story. We went to the lake, and he just had no front tooth, and nobody really asked any questions. So the point is that we hope that nobody notices, but of course they notice. So when we have age spots on our face, they do notice. But we hope they're not as bad as they look. The point is that when I had those, I did have some age spots, but my wife became very jealous when she noticed that in 3 days they were drastically reduced. And I actually began after the 4th day. The collagen, I could tell that. In fact, if anybody wants to just go on YouTube, look at the date of this show on the air, and then look at maybe 2 weeks ago, anything 2 weeks ago or before, and then see if you can look closely at under my eyes right here. It is really the collagen level that is in there. I swear I didn't look this 13 years ago. And so there was a time where I thought there was only one option. And again, this is why you want to come in for your free consultation with Arizona Laser and Skin. I thought there was just the option of either giving myself a facelift,
or just live with it.
Or just live with it, right? So it doesn't have to be an all or nothing. And this is what I'm as excited about the CO2 fractional laser, if you can't tell, as Dr. Robledo is, because it actually works.
Yes, it does. And you know, the thing about the CO2 fractional, and you know, we talked about it's a great treatment. You still have to, you know, even though the CO2 fractional lasers are very safe nowadays, you still have to do your homework, and you have to make sure that anytime you're considering this kind of treatment, it should be done by somebody that has experience doing them. You know, fortunately, in our clinic, and Dr. Lee, you know, knows that very well. Our staff, including myself, we're all very experienced in all the treatments that we provide our patients. You know, I've done hundreds and hundreds of CO2 fractional laser treatments. So we have, you know, you said we have the experience, we've learned how the settings, what are the best settings for each patient. We tailor those settings. You know, so it does still require, even though it's a very safe laser, still does require for you to make sure that the person that's going to do it for you has experience in order to obtain the best results with minimum problems.
We also actually correct the people who are scarred elsewhere.
Which is pretty amazing.
Yes, we have seen some complications with this type of treatment, and people can get scarred, and the scars can be very detrimental to the patient. And we actually are experienced in treating those conditions too, to actually remove those scars.
Definitely, just a great experience overall. Also, since I just went through it, I'll share with you the overall experience.
I was going to ask you, did it hurt?
If anybody has ever plucked their eyebrows, now don't ask me why I know what eyebrow plucking feels like. But if you've ever plucked an eyebrow, that's about the most pain, even without the anesthesia.
Right.
You know, but they actually did
You're
put a
gonna feel
local
a little
anesthesia.
bit,
Yeah,
yes.
you'll feel a little bit, but it was actually pretty close to comfortable. I think the word that Dr. Robledo
All you
used was
have
comfortable.
had is the numbing cream.
Yeah, I just had some numbing cream, so it wasn't like they put me under or anything like that. There was some numbing cream, and that's really all that was needed. It felt like a very light sunburn, you know, when I was done. So it's not extreme pain by any stretch. Go ahead.
Were you able to still go out
Yes.
the next few days?
In fact, even though I probably wasn't supposed to, I actually dropped by the office after I was done, and I did have some Vaseline on my face. The comment, rather than saying, "Hey, why are you red or why are you swollen?" The comment was, "Oh, I thought you were sweating," because the Vaseline was shiny. So you know, obviously not extremely invasive. I did have a little bit of what it felt like was very, very light. If you've ever had a very light, go ahead.
Sandpaper.
Sandpaper. That's what I was looking for. That kind of sandpaper you feel if you've ever had a very light strawberry when you skin your knee, and it kind of scabs over. But it's not noticeable. You know, it doesn't look like a scab. My son, who's 14 and very analytical, got really close up on my face on the third day. He said, "There's designs I can actually see, and that it's pretty exact."
Bionic eyes.
Yeah, absolutely. So, but unless somebody's doing like my son and getting right up within about 3 inches of your face and looking close at it, it's almost undetectable. So downtime is almost nothing. Obviously, I did the light version of it. I think if you do the more in-depth version, there's going to be a little bit more downtime.
Exactly, and it all depends on what the patient's needs are, and you know, some patients can afford downtime, some cannot because of work.
Mhm.
And so the nice thing about it is that if you have, you know, a texture problem, a pigmentation problem, lines, wrinkles, you can address it either way. And just high energy means you're going to get it all in one treatment. Low energy means you're going to get several treatments, but at the end you're going to get the same results. And the nice thing about the laser resurfacing is that we can supplement it with fillers, with Botox, with other skin tightening of the neck, etc. And we can actually make you look very good without any kind of surgery. You know,
Yeah.
just
And
using
without
these
any
systems.
scars.
Yeah.
And without scars, and if you have scars, they can actually reduce those, which
That's
is
right.
nice. Absolutely. So it looks like we are coming in at the close of this segment. Thank you, Dr. Robledo, for joining us.
Thank you
and,
very much for inviting me.
You bet, and thank you for the treatment. What an amazing experience.
You're welcome.
You're going to be gaining a client in my wife who is pretty much clamoring, trying to figure out how to get an appointment made. So again, if you want to start your own free consultation, either go to www.azmdlaser.com or call the front desk.
At 480-598-9733.
And it is a free consultation, so don't be worried that you're going to be billed for for your first visit. They'll be able to determine if CO2 fractional laser is the best for you, microdermabrasion, whatever the case might be. So again, thanks for tuning in to Ageless Living here on Voice America and World Talk Radio. This is Kurt Wilhelm, your co-host of Ageless Living, joined by
Dr. Lee here.
All right, don't go away. We'll be right back after the break talking more about how you can have holistic living, balance, and health, and how to take care of over supplementation potentially.